Welcome to today's webinar. This is Mike Steckline, partner with the Institute for Enterprise Excellence, with a topic that I've been covering for a couple months. Actually been exploring some of these ideas for a couple of years. It seems with the pandemic event, there's been more pressing interest to learn about this and know about this. So I'm going to be covering some of the topics. And some of them are going to be repetitive for previous presentations, but I'll be explaining why I'm doing this today in sort of an experiment. So the lines will be unmuted. And if you want to mute yourself, your background noise to minimize it, that would be great. But I'm hoping that we have a chance to do some interchange with each other and have some discussion. So this will be less of a one-way conversation and a bit of two-way conversation. Before I get into the topics that I usually cover, what I've been doing the last couple webinars is providing some helpful links to resources that I find to be useful. And so there's some bit.ly links on this particular slide. Al Franken has a nice one on a podcast called No Kid Hungry. Some people that he knows have been doing work to provide food for children, and that's become something that's been an important need with school kids and their reliance on those sorts of meals. Preet Bharara, a podcast that I like, did a nice web podcast on what he called the new threat matrix. It was actually by two people that he turned the show over to, and they did some reflections on what happens after a situation like this. Say, for instance, after 9/11, when people did a review and talked about adjustments that needed to be made. So I liked that podcast. There's another podcast I like called the Happiness Lab, and the presenter did a nice presentation, a couple presentations specifically devoted to the coronavirus situation. The one that I have here on this bit.ly link is an interesting one talking about griping and gratitude. So I think you'll find that of interest. And then the people from Gaping Void have put together an ebook and a way to say thank you specifically to nurses, with May being National Nurses Month. And so I think you would find that to be of interest. As usual, what I've been doing the last couple webinars, anybody wants to hang on at the end to have any discussion or chat, if you've got the time, happy to hang out. So I hope that this webinar finds people happy, healthy, coping with the situation, and perhaps some of the things I'll be talking about are going to be beneficial to help people to think about these things and move it forward. So the reason why I'm doing this webinar in this format today, I had a conversation with a friend and colleague, Brian Lassiter from the local Performance Excellence Network. And I know that he's been doing a number of presentations on and featuring organizations reflecting on the experience and working through this. And he and I had a conversation about some of these topics, and I tried to boil it down to what could be conveyed in sort of a 30-minute explanation, just scratching the surface about what this would be like, to focus on some topics, call it the what and the so what, and then the now what, with the idea that if there is interest, people could learn more about the background science behind what I'm going to be talking about, as well as deeper studies, some of which I've been talking about on my webinars. So the experiment today is to allow for some interactivity, and the idea is perhaps a webinar like this could be offered to members of the Performance Excellence Network that would find benefit in not just learning about some of these concepts, but actually having some interaction and talking about real life problems. So today's webinar is a bit of a experiment in itself to see if that approach has any utility and usefulness for a performance excellence network. So what I'm going to do is go over some materials about what I've been talking about as far as complexity science, and then I'm going to turn the conversation over to some examples to reflect upon the experience with the pandemic um, experience, and get some interaction with the folks that are interested in talking about today, as well as what they can do, what everyone on the webinar can do, as well as those that listen to the recording can do, as far as capturing some of those experiences, which we could discuss at a future webinar. So I want to talk about a framework that helps us to make sense of the world and how to act in that world. It's called the Cynefin sense-making framework. It's been around for quite some time, a number of decades, and a number of industries are aware of this framework. It's based upon the synthesis of a number of disciplines: complexity science, anthropology, cognitive neuroscience, and the term that its creator, Dave Snowden, uses, he calls it Anthro Complexity. So the complexity involving human beings and human systems. It, by the way, was instrumental in counterterrorism work efforts both before and after the 9/11 attack. And I mentioned Dave Snowden. This is a picture of Dave there. That's his company, the Cognitive Edge. That's their website. And if you need a handy resource to learn about specifically this Cynefin sense-making framework, the Harvard Business Review article from November 2007, that's been almost, 13 years, has proven to be a very useful article, one of the most cited articles. It received some awards, quite a useful article, and I often reference that for people that want to learn more about this. I think, and others that I've been talking around the globe would agree that this pandemic we're dealing with has triggered a need for a new worldview and how to navigate problems. And then thinking about Anthro Complexity as this new paradigm. Some people do or don't like the word paradigm. I'm just going to use it just to say, I think we are talking about a reframing about some significantly different ways of viewing our world. So the way I've been unpacking this with folks is to think about 3 new rules that we need to think about, and to serve as an overview of the Cynefin sense-making framework. If you can envision a piece of paper in front of you turned in the manner that it shows on this slide, so looking in a landscape format, you can think about that blank sheet of paper there. The first thing I want to think about is rule number 1 is the idea that not all situations or systems, I'll be using the word systems, are the same. So context does matter. So on that sheet of paper, thinking about on the right-hand side, thinking about things that are more ordered, where there's predictability and certainty. And then think about on the opposite side of that sheet of paper toward the left, an unordered sort of domain. And this is where things are unpredictable and uncertain. Now I'm going to talk about the 4 corners of that sheet of paper, starting with the lower right-hand corner, in a category of systems or situations that has been described as clear. Previously, the terminology was simple, and then it was changed to obvious. Perhaps you'll see why the word clear is now being used, but this is a category where it's pretty clear what everyone should do. Everyone can agree it's the right thing to do, and we all proceed accordingly. Upper right-hand corner, still on the ordered side of the domains, things are complicated. This is where it requires expertise to figure out what to do. You're going to need to do some analysis, and so it could still work on the right-hand side, the ordered side of the domains, but it is not clear-cut, and it's going to require more work and effort. Upper left-hand corner, the distinction between complex and complicated is still being sorted out by various experts. This terminology for complex is what I'm going to be unpacking a little bit in the next couple of slides. And then the lower left-hand corner, things are chaotic. And the way Dave Snowden describes this, if you think about systems in nature, there's really 3. There are systems that are ordered, and those are represented on the right-hand side, systems that are complex, and then systems that are chaotic. And he breaks the ordered ones down into two types on the right-hand side. So that's just a orientation framework to talk about, to set the stage for what I'm going to be talking about. So I'm going to be tracing through these four corners and then getting to a fifth domain in a bit. But the first pass through is just giving some examples about what we mean by something that's in the clear domain where it's ordered. And the example is the agreement that everyone in a country is going to drive on a certain side of the road. In this country, it's the right-hand side. And we can all agree that's what we're going to do. Things work out well when that's what everyone does. It doesn't mean that you always drive on the right-hand side of the road. There could be situations where perhaps a kid or somebody jumps in front of your car. You would swerve to miss that person, go into the other lane. But in a general sense, everyone can agree that that's what we do. In the complicated domain, you might think about needing to go see an expert or getting some analysis before you can proceed about what's the right thing to do, medicine being one example of that. In the complex domain, the example that Dave uses in his explanation of this, and I'm putting the bit.ly link to his story about managing a children's party, I think is a good example about what it's like to think about a complex system. Really, anytime you've got human beings involved with disparate viewpoints, intentions, ideas about what should be done, many times you will be dealing with complexity. And I'll be unpacking that a little bit in the next couple slides. And the fourth domain, lower left-hand corner, where we have chaos, used to be getting people to reflect upon what it was like immediately after the 9/11 attack. I think what we're now experiencing with the COVID pandemic will be a new reference point to think about being thrust into a chaotic situation. And what is that like? And how do we manage our way through that? So again, retracing through these four domains, with the clear domain, lower right-hand corner, this is where the relationship between cause and effect is clear. So we know that when we do this, we're likely to get that high degree of certainty. In the complicated domain, still on the ordered side, there is a relationship between cause and effect, but it isn't self-evident. So this is where you need to be consulting with the people that know the most about the subject matter expertise that's going on. In the upper left-hand corner, cause and effect is only evident in hindsight, but it only is evident for that time because the conditions that came together that caused something to seem to work some way one time is not necessarily going to work the next time. So this is where we have to understand complexity science to understand how do we manage and navigate through that. In the chaotic zone, this is where there is no cause and effect, or at least it's non-existent, not evident. And thinking about this, we need to realize that chaotic systems really are a temporary state. Pretty soon, somebody's going to take some action to move out of it. But we'll be talking a little bit about the choices of that action that occurs with working out of it. Going back to the lower right-hand corner, examples of clear systems, clear situations, in addition to which side of the street do we drive on. Recipes often fit into this category, providing checklists, having procedures. The word standard work is used, and it could be argued that standard work, we're not so sure if it is down in the clear category. Some people view it that way. Some people view it more in the complicated realm, and I'll be talking a little bit about that. But it's clearly an attempt to make order of situations, and it's clearly on that right-hand side of that sheet of paper. Examples of the complicated domain, I mentioned medicine, law, engineering. Really, anytime you have some expertise involved, people that understand how things fit together and work together. The example of all of the parts and people that needed to work together to be able to put a man on the moon and get him back again. It's a sum of the parts sort of a system that it all fits together and it works that way. contrasted with a complex system, again, where you've got disparate viewpoints, different hypotheses about how to proceed. And anytime you've got people involved, you may be into this situation. And so it's an important aspect that I think we need to learn about. How many times are we dealing with these sorts of systems in our world? I think this sheet of paper in front of us is not necessarily representative of the percentage of time that we are dealing with complex systems. I think that domain is actually quite large. And then example of the chaotic domain, when we have workarounds that people are using in an organization that fail, and those workarounds come about because people are trying to cope with rigid constraints, and I'll be talking a little bit about that, that's when we have catastrophic failures. So I think the COVID situation is one example, but we probably see this in organizations and in our lives many times. In healthcare, a lot of the work that I've done in healthcare in my career, you think about situations where people have had wrong site surgery or the wrong medication given. And many times that's because people have created workarounds in order to cope with the rigidity of the system. And when all those things finally fail, that's when you get some of those catastrophic failures, those unintended consequences that occur. So that's rule number one. I want to talk about rule number two, which gets into, so if we agree that there are these different categories, what kind of action is necessary in order to help us? If the context does matter, the correct action is going to change based upon the situation we find ourselves in. So in that lower right-hand corner with the clear category, what we do is we sense, we categorize, and respond. So we ask ourselves, what country am I in? Oh, I'm in the United States. That's a category of countries where they drive on the right-hand side of the road. I'll do that, and I'll be okay. I respond accordingly. This is where best practice, the word best practice makes sense. We can all agree that there is one best way to do something. Up in the complicated domain, the action is we sense, then we analyze, and then we respond. This is where we have a distinction between best practice and good practice. Good practice means that within the constraints or the limits of policies or how much education a person has or their experience, they're granted leeway in order to be able to do things because they're the expert and they can have that prerogative to make those sorts of decisions within that realm. Different lawyers will give different advice, different doctors will give different advice, different engineers would give different advice. So there's variability, and that's the distinction between best practice and good practice. In the complex domain, the action that we need to take is, first of all, we probe, then we sense, then we respond. In essence, what we're doing is we're learning by interacting with the system. We're trying different things to see what will work, what won't work. And then the practice emerges based upon those experiments that we try to see how they're going to work. In the chaotic domain, as I mentioned before, pretty soon somebody's going to take some action to try to move out of chaos. So we act, then we sense, and then we respond, and we work our way out of the chaotic situation. And that could be something that's never been tried before because the chaotic situation has not confronted us before. So we have to try something, anything to try to move our way out of that. I'm going to use some examples of constraints as a part of the definition of these systems. There's a lot of literature out there about how do you define a system. Dave Snowden and his team uses a constraint definition of systems. And you think of constraints, if you're familiar with Goldratt's theory of constraints, constraints aren't just things that limit action, they can actually enable action. So constraints, there's sort of two general categories, things that contain or limit and things that enable and connect. So if you think about the exoskeleton of an insect, it's an example of a rigid constraint. It's an external constraint. An endoskeleton, or the bones within the body, different structures can be built on that, and you can enable the actions to occur. So those types of constraints connect. So in the clear category, we have fixed or rigid constraints that are put in place. All of the rules and regulations and the training that goes into making it possible for people to agree to drive on the correct side of the road are put in place. A lot of energy spent to try to get that in place, to keep it in place. But those are examples of fixed constraints. In the complicated domain, this is where we have those governing constraints. Think about the policy about who has the sufficient expertise, who has the sufficient experience, knowledge. Within that ability, they have the leeway to take different action based upon their expertise. And in the complex domain, this is where we have enabling constraints. These are the, as we make those experiments and those probes, and those, a good way to think about this is those heuristics or rules of thumb that we develop to try to guide our actions, to try to move our way out of the complex, and we'll see where we might go after moving out of complex. And then back to chaotic, this is where there really are no effective constraints. Anything can happen. Anything is possible because all of the constraints have been removed. There's two ways to get into the chaotic domain. You can enter it accidentally, which in my belief, I think that's what happened when we were all tossed into the situation with the COVID pandemic. And the action to take when you find yourself here accidentally first is to stabilize. So get things stable, try to figure out what you can do to try to move, to get some semblance of control, and then to move forward from there. You can also use this deliberately if you remove constraints, and this is where innovation comes from. It takes a lot of energy to try to remove constraints to make it possible for people to free up their thinking and to really innovate new ways of creating things. And I'll be talking a bit about that when we get into responses to the COVID pandemic, because what's actually happened is the constraints have been removed and people are innovating and taking action in ways that perhaps they never have had to do that before. But the problem is, and this gets into the fifth domain, that's why this is not a 2x2 matrix, it's a 5-domain framework. The problem is we tend to act based upon our preference. I think we've grew up and learned a lot of the things in our profession, in our world, and we've lived on the right-hand side of this piece of paper thinking that it was the only way that the world worked. And perhaps we even lived in one corner of it thinking that, for instance, in the lower right-hand side, that people that like rules, processes, standard work, they are very comfortable with solving problems by putting forth rigidity of fixed constraints. And so that's their go-to approach. People that like to bring in expertise, if they feel we just spend enough time and get enough people involved, get the right experts involved, they like the complicated domain. People that like to have a lot of conversations, get a lot of perspective, try a lot of different things, they actually like the complex sort of domain. And believe it or not, there are actually people who actually like to stir up and create chaos. They believe that's the best way to manage. But that is the problem, because if we proceed from our comfort zone, we're not matching our actions based upon the situation we find ourselves in, which gets into the fifth domain. The word that's being used now is confused. It used to be disordered, but you can see the wisdom of using the words that are represented now. They're easier to remember. They all begin with the letter C, and so it's a good way to think about that. When we don't understand these differences between the different types of systems and we take action based upon our comfort level, we're actually acting perhaps counter to the kind of system that we're dealing with, and that's why it's called confused. So, and we're not likely to get the right progress unless we better match our actions to the kind of system that we have. So rule number 3 is to move beyond just thinking about this as a way to categorize things and thinking about a way to understand the types of action that are needed. And there's a number of patterns that are showing up that have shown up in the literature and the research on this about the dynamics of moving around between those domains. That's the magic of this. It's not just understanding placement, it's understanding the ability to navigate and move between the domains. So I'm going to start this time in the upper left-hand corner and talk about complexity and how do we manage complexity. I mentioned probes. This really involves multiple parallel safe-to-fail experiments, simple things done in parallel. And parallel is important. This is not a matter of let's figure out a pilot to try. This is trying many, many things in parallel. Many are going to succeed, many are going to fail. And it's going to be the interaction of those experiments probably that is going to give us clues about what's going to be more likely to work. So the system is going to evolve, and we're going to be able to try to nudge it in a direction that we'd like to go. Some questions you're asking is, so what are the things I can change? What constraints could I change? What sort of things could I try? And when I change those things, do I like what it does? If yes, I'm going to give it energy and attention. If no, I'm going to dampen it and I'm going to shut it down. The thing to think about and understand about complex systems, and sometimes these are called complex adaptive systems, is there's always going to be unintended consequences because we don't understand the cause and effect relationships. We're going to have some things that we didn't plan happen are going to happen. That's why making those experiments small, safe to fail, be able to recover is going to be very important. Now you do this in an effort to try to get a little bit more certainty into your world, which is where most people would like to be. And some of the experiments are going to be able to be seen as we're figuring out cause and effect. And you might be able to move some of these over into the complicated domain because we're figuring this out. But don't get too comfortable because you need to be able to navigate back into additional experiments and to go back into complexity. And this is especially true if we too quickly settle on a solution and try to move it too quickly over to the right-hand side. Again, unintended consequences are going to cause us to realize that perhaps we need to do some more experimentation. So that's one dynamic. Another dynamic is to realize that a few of those solutions, let's call them those, can be moved down to this domain. And the word obvious is there. That's what it used to be called, down to the clear domain. And everyone can agree this is the current best way to do things. I'm going to start drawing out the rest of the Cynefin sense-making framework here just to show that there's some things that can occur if we move too many things down to this side too quickly, and to really understand that the boundary between complicated and the clear is more of a continuum. It's not a clear line that you can think about that way. The boundary between chaotic and clear, however, is more like a cliff. That's what that little squiggle toward the bottom is intended to show. Think about a sheer cliff that you're on top on the clear side, and the bottom of the cliff is down on the chaotic side. The reason this becomes important is when we over-constrain a system that is not constrainable, and we put too much rigidity into it, you're going to find people are going to create informal workarounds, informal systems, and they're going to make the outcomes happen in the best way that they can, not because of the systems that have been put in place, but because of the informal approaches people are taking to try to cope with the reality. And you're going to find people moving to that complacency zone, which is close to that cliff. When there is going to be a catastrophic failure, that's when we fall over the edge, and chaos is going to be very, very difficult to climb up that cliff. And to round out how the diagram looks, you can see I put a line up there on the upper left hand to talk about the boundary with complex. Now there's another line to understand, and this is sort of a new version or an updated version of the Cynefin model. This line that's drawn here shows that there's a phase shift between these particular domains, and this is called a liminal zone that we see between here. There's been another word that's been added into the model Aporetic is perhaps not a commonly used term. The difference between being confused and aporia is when you're confused, you don't understand that different systems are even involved. With aporetic, what you're doing is you're sort of at a loss. You're trying to figure out which way to go. And it's a different sort of feeling. And that perhaps will become evident as we move through some of these domain moves. I mentioned these different dynamics that are going on. And the movement between going from complicated and complex and back and forth, that's represented by that blue circle there called exploration and exploitation. Exploring different ideas and then exploiting them. What can we move toward the complicated, and when we need to move back again when more experience is required. The green domain line is represented by things being very rigid. A few things go there, but not everything and not a lot. Again, there's an investment in doing that to try to maintain them. This periodic movement down into chaos, and it's that part of chaos in the liminal zone there where we sort of skim into chaos when we remove constraints, and this is where innovation occurs, where we periodically disrupt the thinking of experts, of people that are in that complicated domain, and see what we can do to bring out new thinking. And then the final movement is really around continuously scanning and incubating and exploring and experimenting. And as the world seems to be changing more and more frequently, ever more accelerating, this domain dynamic seems to be even more prevalent. So what does this mean as far as the COVID pandemic? And I'm relying a little bit upon a website by a gentleman by the name of Chris Corrigan that came up with some of these examples. But it's really where we're going to be taking this conversation next is if you understand these different sorts of systems, the different actions required, the different moves that are possible, what does this mean from a practical sense as far as coping with the virus that we're dealing with? So here's an example of a clear system category. The agreement by everyone, we should all wash our hands often with soap for 20 seconds. That's an example of some action that we could all agree that's what we should all do. Another category here, response to the chaotic domain. If you find that you are infected, say you got a positive test or you feel the symptoms, you decide to self-quarantine to stay apart from others until you can get healthy or get that resolved. I mentioned innovation, and this is where people are figuring out different things, trying different things. Innovation occurs when three different factors come together: starvation of resources, pressure of time, and a change of perspective. That's where you get innovation. And that is what has occurred with the response to this pandemic is you don't have all the resources you used to have, so you have to figure out what you can do with what you have. You have pressure to try to figure it out quickly, and it really is resulting in the need to take on a totally change of perspective. In the complex domain, what things can I try? See how things work out and adjust accordingly. So a lot of trial and error, a lot of experiments. Some things are going to work, some things aren't. That's where you see that happen. As you see, some things seem to have some pretty good track record. They seem to be moving. You can move them into this liminal domain and see if it is now time to think about being moved over to the complicated. An example in the complicated domain, perhaps you need to get some expertise as more and more people have been figuring out, so how do I work remotely? I've got to figure out a way to communicate with others. Perhaps I'm not familiar with platforms such as Zoom or Skype or whatever. I've got to figure that out. I got to get some consultation, find out who has the expertise and figure it out accordingly. The last thing I'll say about examples, and then I'll open it up for some more discussion as we get into this. It goes to another series of questions that Dave Snowden has advised and thought about over the years. and it is response to data. Do we see the data is one question and process. Do we pay attention to the data is another question and another process. And will I act on the data is another process and another question. So the data that we have, the data that we see, it's way more challenging than just say, let's get the right data to the right people, they'll make the right decisions. Humans, the way humans make decisions, really requires us to think about, will they even see the data? Will they pay attention to what the data say? And then will they act on the data? And so I think those are important questions, whether we're thinking about responding to data from a national level, from a state level, from a county level, from a company level. I'm just using examples of the data in this example. Obviously, these questions came up. Dave talked about these before the pandemic was upon us, but I think they're pertinent to this situation as well. And I think the response to that, how different groups are responding to the data, says a lot about how people, some are being more successful at navigating out of the situation than others. So what does this mean? This is going to be an example. I'm going to do some pause here and get some interaction with folks. But I'm going to make a possibility for you to think of some examples that you might have in your world, whether it's the work world, home world, and to provide some examples using some data submission using our website. So the way I've put this together is I've got a couple blog posts that have been put together, and I'm going to show you some of those. And if you go to the bit.ly links, you're going to be you'll be able to actually do this. If you go to that first bit.ly link there, or if you go to our blog post and just look up that, and you find the blog post for the complexity, Cynefin, coping, and the instruction page, it's going to take you to this page. And this is the instructions about how I'm going to solicit input from folks, both those that are on the webinar today as well as those that listen to the recording. So you go to the instruction page, and there are sort of these 6 points here. The first one is, and it's what we're going to be doing, is getting you to think about several personal examples of challenges and struggles dealing with the COVID-19 pandemic. As I said before, they could be work-related, could be home-related, or both. And then write a sentence or two about each of those experiences. And then think of a couple of categories. So if the experience that you have, you think about there's a single right answer that you found for solving that particular challenge, you would go to this bit.ly link or go to the hyperlink that you'll see on the website and just type in the example of that. If to work your way out of the situation required relying on expertise, you go to this particular link or that bit.ly link. If there was, when you think about your example, there was no way to predict what would and wouldn't work, you're going to provide that example in that situation. If you think your example was one where it was critical to act immediately, you're going to put it into this blog post here. And then if you're just uncertain and you don't know, you're going to put your example onto that bit.ly link there. The results of these are going to be summarized, and then at the end of the month, I'll be having another webinar. We'll be going to be talking more about the examples that people posted. This is a bit of a play on an actual exercise that I've done face-to-face with people to get people to think about examples to make the Cynefin sense-making framework more than just something that perhaps is academically interesting, but something that actually ties it to situations in their real world. So to get you thinking about this, there's a couple situations that I've thought about. They're not exactly the ones that perhaps everyone would be thinking about, but here's a couple examples. So just looking at COVID case and death rates so far, why does the US seem to be higher than other countries? Another example I thought about, I've got a daughter-in-law, she's a high school science teacher, and because of the situation, she's homeschooling kids, our grandchildren. And I've noticed different innovative ways of teaching. One example was teaching the younger kid to count by twos. And so they took all the shoes in the house, lined them up in pairs, and then counting by twos. I thought that was rather interesting. Uh, Again, going back to another example, different states ordering and paying for personal protective equipment, and then a government agency seeming to take them away. Just examples that get me to think about what's going on, again, making sense of the world. Another example, a local visit to some stores. I just noticed that one seemed to have some pretty good systems in place for protecting staff. They had plexiglass up, they had masks on, they had different markers, they had different visuals for both the staff and the customers, different cleaning practices going on, pretty clear. And then the other one was clearly a contrast to that. So I was thinking about what's going on there, trying to make sense of that. Then going back to a higher level here, just noticing and reading news that New Zealand has apparently eliminated the community spread of the COVID-19. So what's going on there? Where could I think about that as an example? I've noticed different ways, innovative ways that people have been creating protective equipment, PPE, and I'll see a lot of stuff on Twitter and other social media, different innovative ways people are doing that. And then just going back to our state, the Minnesota governor announcing how the state is going to gradually try to remove the COVID restrictions. And he used the terminology about thinking about three knobs are going to adjust. He talked about what's going on with businesses, what's going on with schools, and what's going on with healthcare. And based upon how that's working, what he would be doing accordingly. So what I want to do is offer a little bit of interaction time here. Anybody has any thoughts on where they might place any of these examples or any examples of your own? Just speak up, the phones are unmuted, or use the chat function to type something in, and we'll chat about different examples. You can reflect upon and give me some ideas about where I would put some of these things. So I'm going to pause and see what input people have, or what examples you might offer of examples of people coping with the COVID situation.
Hey, Mike, this is Brian Lassiter. Can you hear me?
Hey, Brian.
I'll be thinking of an example, but I really like what you've done here. If people don't know me, I am behind Performance Excellence Network. I see Carol on the call, and she knows us well. I'm not sure I recognize many of the rest of you, but Mike and I have been talking about this concept now for a little while, and for me, it does help make sense of the situation of any situation, but especially the one we're all in right now. And I really like what you've done between the last time you and I talked and this presentation, this discussion, is to try to translate it into real application. Mm-hmm. So I am going to think of an example here in a second, but I just don't have one off the top of my head. But I just wanted to give you some kudos for extending this another step or two.
Yeah,
because by itself it's just academic, but putting in an application and really helping us do something with it, I think is the natural next step.
Yeah, I appreciate that, Brian. And I was listening to the webinar that you provided with the three speakers. That was yesterday, right? Or was it the day before?
A couple of days ago, yeah.
Right. And then reflecting on what they were saying. And as they were discussing, I was sort of making connections and saying, well, that sounds like an experiment. That sounds like something that they're trying to figure out, will this work, won't it work? And I would put that into the complex domain. But those are just my reflections.
Yeah, I think you're right on. And just so everybody can have some real things to chew on, it's a small manufacturer that's been using the excess capacity to improve process. Mm-hmm. To really dedicate some resource to thinking forward of how they can emerge out of this in a different state. Another one has pivoted completely and developed new products and new products to the marketplace that are more useful than the ones that they were making in the past. Mm-hmm. Yeah, so I think you're right. They all sit somewhere in this framework. Great examples of companies trying to move from one of the quadrants to another one, or back and forth.
Mm-hmm. Yeah, those are great examples. Any other observations? I'm going to walk you through the website shortly, and I'll be showing you, not just asking you to put in some information on the website, but showing you how to do it through my computer screen.
Hey, Mike, it's Jeff Hunter. I need to process this a little bit more, but I was thinking about yesterday when the Wisconsin Supreme Court nullified the state's ability to manage on a statewide level the emergence out of COVID, and the legislature, which is controlled by one of the parties, is going to leave it to the local governments to figure it out. And so, as they say, we kind of went from one approach to what will now be 72 approaches, or maybe even other minor civil divisions. And so I'm thinking about that in the context of this framework and what it's doing.
Do you have any thoughts on if you had to pick a starting point, or at least think about how you would make sense of it using the framework, where you might place it?
Well, I think it started in complicated, and is, you know, as of today, it's, when you read people's reactions to it, it's pretty chaotic. I mean, there will be owners of businesses today who just don't know what they're supposed to be doing, because the direction that they're getting and from who changes minute by minute. So
yeah, and you know, for these big situations, it's very hard to say. I think this big thing is an example of this one part of the domain, and I think there's aspects of any problem that might have some bit of clear approach. You know, let's try this and let's make it mandatory for everyone. How people respond to that, the workarounds that are put in place. So, yeah, I think it certainly helps me think about what's going on, but also what do we need to do to make progress, and is it helpful to leave it to 72 different ways to figure this out, because I don't think the virus cares about you know, those 72 different counties or whatever. It just moves around, right?
Right.
Yeah. Mike, this is Yvette Senna from New Mexico.
Hey, Yvette.
How are ya? As I'm looking through the examples, I feel like I can see the left side versus the right side, but I am struggling on the left side between complex and where I would fit some in complex and some in chaotic.
So do you have a healthcare example in mind? I know you work in healthcare.
I actually, for some reason, I just can't think of a healthcare, but I can think of a personal one.
Yeah, go for it.
We were actually out of the country when COVID hit the U.S. hard. So our flights got canceled and we were struggling just to get back into the States. And then when we got back, we were like, what just happened?
Right.
And it was a struggle to figure out how to get back in.
Yeah, so you were probably, I'm just going to be going back to these slides, you were probably thrust off the cliff over into chaos, right? And you no longer had the flight you planned. All sorts of other things were being put in place, the restrictions to come back into the country. And you pretty soon had to figure out, first of all, how are we going to get back? And then what are we going to do, right?
Yes.
Yeah, so you probably got thrust off the cliff over into chaos. And then as you were trying to figure that out, you might have had to be innovative and creative in order to make the right calls, or just get lucky, hopefully, to move your way out. And then you had to figure out, so what does this mean for our home life, right? What does this mean for work? What sort of things are we going to be able to, what's okay, what's not? And then you probably found yourself up into complexity, right?
Yes, that makes sense.
Yeah. And then over time, as you got things got more stabilized, both perhaps at home and work, you probably have been putting together some more reliable systems, both at home, at work, to try to say, well, it looks like we're going to be using Zoom for a while. Looks like we're going to be exchanging information by phone call and email, looks like I might not be able to actually go into the facility as much as I'd like to. So, but I can probably figure those things out. And you're probably trying to make your way back over to at least complicated before you're perhaps developing some, procedures that are going to work pretty permanently for the future, which would take you all the way back to clear. But they're probably not going to look the same as they did before the COVID situation, right?
Yeah, yes, that's correct. And for the healthcare example, I'm thinking we were probably in chaotic, very quickly developing new systems.
Mm-hmm.
And now as we're thinking recovery, we're probably a little bit chaotic, but maybe more complex. We're trying to figure out virtual visits and telephones and Zoom and, what's new criteria for seeing a patient in person or not, and how do we get
Right.
surgeries back on track?
Right. Yeah. So you and your team are probably doing a lot of experiments, finding out what works, what isn't. What are the customers or the patients going to actually follow? What has to be put in place to explain to them what's going on? How do you get them to wear masks? How do you get them to, come in for a visit and feel safe? And then it isn't so that we're returning to new normal or to a new normal. We're trying to transcend the disaster to try to figure out what our new systems are going to look like. That's how I've been thinking about it.
That's very helpful.
Yeah. Thanks for offering that example.
Mike, maybe just one other example. I think as hospitals have been figuring out how to emerge from this and get back into the elective surgeries, a number of them have been trying to use algorithms to determine what types of patients need it the most. And I think they might be maybe thinking of this in the complicated domain. But
Yeah.
what they're realizing is that they're getting a lot of input from different specialties who want them to start their particular specialty next, and it can be quite economic driven.
Mm-hmm.
And so I think where it maybe started for them was in complicated. I think their solution is they're having to move over into the or it started in complex and it's moving over into complicated.
Yeah. Yeah. Okay. So what I'm going to do now is I'm going to show you on our website, if you've got some input to give, and if you go to the different blog posts that I put together, if we think about an example of a situation where there was one single right answer, I would click on this link right here, and it would take me to a different blog page, and it's going to populate here. It's going to allow me to put in some data and give an example of, what would be, there was a single right answer that was possible. So Yvette, in your example, when you were working your way perhaps back to the country, and it was clear that there was one simple right answer, and you can see what I'm doing here on my screen. I'm going to provide a comment. So was there any situation where there was a clear single right answer that this is the right thing to do?
I'm trying to think that through. Yes, we knew we had to get new flights, and we couldn't get flights together with my family, so we had to split up, and we just said that's what we have to do.
Right, right. So let's split. So it was, travel back to US.
Mm-hmm.
I'm just showing you how I would put this up. Okay, so that's an example. So anybody can go onto this, and we would put, I would say here, Yvette, and I could just put the email in there. But anyway, you would put your name here, put your email, and then you would post the comment, and then that'll be then showing up on our website. So I'll have a number of examples from each of the categories, and then we can talk about this in the at a future webinar. So that's how we're going to be generating examples of coping with the COVID virus. Oh, that's because I didn't fill in the name, but I'm going to let you fill that in, Yvette, when you do that as well. So that's an example of a single right answer. Any other ones that people come to mind? Let's say where you had to rely on expertise. Somebody had to rely on expertise. You didn't know the right answer, so you had to find out from someone, you know, what's the right thing that could be done. Any examples of that?
How to do virtual whiteboarding.
Okay. So you had to figure out, is there anybody that's done that? Are there any platforms that have been experimented with, things that have been trying?
Yeah, which one seems to be working better than others? Which ones have what features? Yep, get advice.
All right. So in this situation, Jeff, you would say your comment would be virtual whiteboarding for remote consultation, right?
Yeah.
Okay. So then you would post that example there. So again, on your own time, take the time to think about this and try to say, you know, where did these different categories fit? Did it fit into something that looked like I kind of knew what the single right answer might be? There was no way to predict, so I had to experiment. Or if you're just uncertain, just put some examples here under that category, and then we'll see what people generate as far as output from this webinar. So that's the plan going forward. And this whole webinar was a bit of an experiment, and Brian talked a little bit about his work at the Performance Excellence Network. So we were going to try something like this to see, is this sort of a conversation like what we're doing today on today's webinar, and the experiment of getting input with people using our blog post as a way for people to not just understand about the Cynefin sense-making framework, but to actually provide some input here. So just to wrap up, what I've done is I tried to give a high-level overview, just a 30-minute explanation, and it really tried to feature, you know, understanding a little bit about Anthro Complexity, which is what Dave Snowden talks about. This Cynefin sense-making framework is just one manifestation of this new knowledge. What does this mean in the so what? I think this framework can be very helpful to make sense of the world, and so that we know how to better act in it. I think coping with the COVID pandemic has thrust us into this new way to view things differently. An important point, there is no one-size-fits-all model of management. I think one of the reasons why this has shown so much appeal is it does allow a multi-methods approach. There's different methods that do work on the right-hand side, and we shouldn't give up on those, but we need to understand that those methods aren't going to work in the chaotic and in the complex. And another so what is when we don't understand this, we tend to make matters worse. As far as now what I'd like to do is feature more discussion as far as background behind this model in future webinars, and then give people an example to provide those examples from today's webinar, and as well as future webinars, you know, featuring deeper study either by presentations that I would give or other presenters that are talking about this topic. So next steps, I would be talking about some of those principles, how people work, how systems work, using natural science as things to think about. And then there's many branches where this could take us into the future as far as, so what do we do with this knowledge? If we better understand these differences, what might that mean in a number of categories? So I've just made those possibilities listed here. If you want to get involved in another level, and if you go to this bit.ly link, there's a way that you could participate in daily journaling. And this is a way to get into another aspect of the work that Dave Snowden and his group have been doing around using different software to capture real life data and to be able to help everyone to move forward into a way that's going to help the whole world cope with this. So what's going to happen next? This webinar is being recorded, and you can go get the recording from that link. It'll also be distributed to those that participated today. A previous webinar that Jason Schulis was going to present in April, it's going to be postponed for a later date. On Friday, May 29th, any input from today's webinar and discussion and examples is going to be featured on April 29th. And we'll also be having more discussions about the science behind the cannabis sense-making framework. And I've got a number of topics that are in the works and developing as well. So just wrapping up, one other point here. My business partner, Max Brown, has put together a terrific podcast series of conversations with leaders working on managing through various challenges, and most recently including reflections upon coping with COVID. And you can get that at that also on our website at that podcast link, or wherever you get your podcast. You can find it under Purpose and Principles. And a final invite, if anybody has any other examples or stories in addition to coping with the COVID situation they'd like to offer up, we're happy to feature it here on this webinar. So I'm going to pause the recording, but if anybody wants to stay around and chat, I'm happy to do that. Otherwise, I hope everyone has a great day, a great weekend, and keep safe. Thanks, folks.
Thanks so much, Mike. Good stuff.
Okay. Thanks, Brian.